What's up everybody, Dr. Rossi, shrinksandsneakers.com. So in this video, what I want to start out by saying is thank you to everybody who's subscribed to the channel and everybody who's been commenting. It's given me a lot of good ideas for how to continue to create content for you guys and to create content that's focused on the things you want to know about, specifically to psychiatry. With that said, what I'm noticing in a lot of the comments and a lot of the discussion is that people seem to really be interested in my thoughts on medication and some of the education I can provide surrounding medications. So that's how I got the idea for this video today. So the title of this video today is the only medication proven to reduce suicide. So what am I talking about? What medication are we going to be discussing? And why do I think it's relevant for you to know a little bit about this? So to preface this conversation, I'm going to start by saying that as a psychiatry trainee, you are pounded with this question all the time because there's only two medications that you really think about when you start thinking about reducing either suicidal thoughts or completed suicide. And those two medications are one, clozapine, and two, lithium. The focus of this discussion is going to be on lithium, and I'll tell you why. Because in the case of clozapine, although we say that it can reduce suicidality or suicidal thoughts, it has not been proven in randomized controlled trials to reduce completed suicide. So yes, it may decrease suicidal thoughts, it doesn't necessarily reduce the risk of completed suicide. However, when we start talking about lithium on the other hand, there are randomized controlled trials to prove that it does reduce completed suicide and suicidal thoughts. So not just suicidal thoughts, but also completed suicide. This is really important, right? Because we only have then one medication that actually is proven to reduce suicide. Now, lithium has anti-suicidal effects even at low doses, so that's important to know. A lot of times people think you need to optimize the dose and titrate it to a proper blood level, and that is true in most cases, especially when you're treating something like bipolar disorder or mania in bipolar disorder. So you do want to get to an adequate dose, but it's good to know that lithium has some protective effects in terms of suicide even at low doses. Now, it can be beneficial not only in bipolar depression, but also in unipolar depression, or what we would consider major depressive disorders. So lithium augmentation in a patient who is dealing with lots of suicidal thoughts or potentially risk for completed suicide, lithium may be a good choice to augment an already an existing antidepressant medication and or to use in place in some cases of those antidepressant medications. So we do know that things like selective serotonin reuptake inhibitors, or SSRIs, and many of the other antidepressants actually have increased risk for suicide in patients younger than 24. So in general, we say that younger patients are more at risk of suicide when they're on those medications. Whereas when we look at lithium, it actually has a prophylactic effect for preventing suicide. Now, the one caveat to this conversation that I'll bring in, and that is sometimes an argument against lithium, is that lithium overdose can be fatal. And that is true. Lithium has a narrow therapeutic window. That's why we have to follow blood levels and make sure that people do not become toxic. However, that risk is somewhat negated or completely negated by the fact that lithium has anti-suicidal properties. So, in summary, we should not necessarily avoid prescribing lithium just because there's this risk of fatal overdose, because there's so much benefit in terms of reduced suicidality and reduced completed suicide. And again, that is backed by actual data. Whereas a lot of this stuff in psychiatry sometimes isn't fully backed by great data. This is backed by good data. So the only medication proven to reduce suicide is lithium. So if you have any questions about lithium, want to know more about it, drop the comments below, and please like and subscribe to the channel. We will continue to make videos about the things you guys are interested in.